Good evening, everyone. I think we're live now. Alison. Okay, good evening, everybody. Welcome to the Woking Borough Council Health Overview Scrutiny Committee on the 26th of September 2022. Madeline, do we have any apologies for absence?
Councillor Margetts.
Thank you. The next item is the minutes of the previous meeting. Does anybody have any questions on the previous meeting? Councillor Alison Swaddle.
Chairman, I was present at the meeting. I joined on Teams. Could that please be reflected in the minutes?
Absolutely, we will reflect that, Alison. Apologies for that omission. Thank you. Any other items on the previous meetings minutes, sorry. Can we go to a vote on that for approving and confirming the meeting minutes from the last meeting? Jackie, would you like to propose? Oh, sorry. Yes, you. Oh, you don't want to say anything? Okay. Sorry, who wants to propose? Beth, thank you. Does somebody want a second? Rochelle, thank you very much. Can we have a vote, please? All those in favour? That's unanimous. Thank you very much. Next item is declarations of interest. Does anybody have a declaration of interest? Thank you very much. I don't see any declarations. Thank you. Public question time. Madeline, do we have any public questions? No public questions. Any member questions either? No. The next topic is Mind. There is a huge report for Mind, and fortunately, we've identified that the whole report is not going to be presented, so you won't need even more caffeine than usual. So please take it away.
Okay, good evening, everyone. It's really good to be with you this evening. My name's Alex Hills, and I'm the Primary Care Wellbeing Service Manager at Oxfordshire Mind and Mind in Berkshire. I'm covering this evening for my colleague Claire Shropshaw. She's the project manager for this project. And I'd just like to start by saying a huge thank you to Woking Borough Council. It's been a fantastic year and a half for us as a charity to get really involved with things in Wokingham. And we feel like it's a really fruitful relationship. So we're really pleased with how it's going. So today I'm going to give you a bit of an overview of the service. So the what, the who, the where and the how. I'll give you a bit of update on how we're doing so far with some data highlights. I'll tell you how we measure our impact, give you some information from a case study and some service user feedback to hopefully bring it to life a little bit for you. I'll tell you how we support the voluntary and community sector locally. And we'll also tell you a bit about the future development ideas that we've got, and then a few questions at the end. Thanks, Madeline. Okay, so for the purpose of the service, I see it in three different ways, really. So I think we have two direct impacts and then a resulting third impact. So initially, firstly, we provide one-to-one person-centered support for local people to support them with their mental health and their well-being. Secondly, we support the voluntary sector. We help them to collaborate around mental health and well-being for the benefit of local people. And the third resulting impact that I see from that is reduced pressure on the wider health and social care system. So as we support people, say via their GP practice, hopefully we're helping to reduce the demand on an already overrun primary care service. So that's a bit about the purpose of the service. So who we support, it's an adult-facing service, so it's 18 plus, and we work with people with a number of different concerns. So in the mild to moderate mental health, mild to moderate anxiety and depression, we'll support people with other social needs, such as drug and alcohol use, loneliness, isolation, and we also offer a service to carers as well, due to the impact of their caring role on their mental health. Okay, service access criteria. So this just tells you a little bit more about who we support. There's a bit more detail on this slide. So the service is for anyone registered with a GP in the Wokingham Borough or anyone who is a resident of Wokingham Borough. We do have some examples of residents who are registered with a GP outside of the borough, but they can still access the service. So we support with a number of things, thinking about things like stress, poor sleep, difficulties concentrating, relaxing, or general sense of overwhelm we can support with. And then some more of those social issues, things like abuse, bereavement, loneliness and isolation. We'll be there to support people with those. We also offer, I think it can sometimes be undervalued, but the listening ear for a good amount of time for people. So particularly in primary care, people may go to their GP and have a 10-minute or a 12-minute, whatever it is now, GP appointment. And we aim to offer something slightly longer so that we can dig into what's really going on for the individual, to make sure that we can support them in the best way possible. Okay. So where we work in all of the GP practices across Wokingham Borough, across the 5 different PCNs, primary care networks. But I've just heard actually that that's now become 6 primary care networks, but we'll be working across the same footprint. So the same GP practices will be represented within that. Okay, so how we go about delivering this service. We have 4 wellbeing workers delivering the sessions across the borough and 1 project manager. When someone is referred to us, they can receive up to 6 sessions of one-to-one support, and that's looking at goal setting with the individual and other forms of practical support for them. It's not a counselling or befriending service. It's very much looking at goals and practical support for individuals. In terms of service delivery, we can do face-to-face support for people, often within GP practices. We can do telephone support or video support. So we try to make it a very accessible service to meet different people's needs across the borough. Okay, the project so far, we started last February. So between February and June, we got together a team of people, a project manager and the wellbeing workers. We inducted and trained those staff and received our first referrals from GPs across the different PCNs in Wokingham. Then in July 2021, we started our engagement with the voluntary and community sector locally, and we had our first mental health first aiders forum and mental health and wellbeing community alliance meeting. And I'm going to say a little bit more on that towards the end. And then September came along and we opened up our referral pathways to include a number of voluntary community sector partners, including Citizens Advice and the Friendship Alliance. And then this year we had what we've termed our sort of full launch, where we've started to accept self-referrals from people. We've opened up to a wider range of voluntary and community sector organisations, still working with primary care and other statutory partners. And we've also moved into the new local hub, so the Waterford House Charity and Community Hub. And we're established on site at lots of the different GPs across the different PCNs. And as of August this year, we're now hitting our target of receiving over 100 referrals a month into the service. Okay, so a few highlights from how it's been going. This is just from the first 5 quarters of the service. There's another quarterly report coming in October. But we've received just under 750 referrals up to the end of June, and offered over 550 initial assessments. One of the things that we try to do is to contact people very quickly after they've been referred to us, and we're very close to 100% of contacting people within 3 days of their referral. We also like to measure wellbeing indicators from point of intervention to post-intervention, and we're really pleased to see that 74% of those who've used the service have shown a significant increase in wellbeing after completion. Okay, and also just to, sorry. Okay, and I did speak to, yes, okay, I did. And just to, as an update as of today, I spoke to Claire, our project manager, and because this is up to the end of June, it doesn't tell you the really up-to-date figures, and we've just in September passed 1,000 referrals into the service since last February. So we're really pleased that it's opening up to more and more people across the borough. Okay, so how do we measure impact through the service? We use a wellbeing indicator called the Short Warwick Edinburgh Mental Wellbeing Scale, so SWEMWEBS for short, and we take this measure at the initial session with the service user and then after the sessions as well at the end of service. We also ask a number of patient experience questions following intervention, and our aim for the project is to have at least 90% satisfaction. But I'm really pleased to say that from April 21 to March 22, patient satisfaction rate was 97.5%. And in the most recent quarter, April to June, it was 99.5%. Looking ahead, we want to begin to survey other professionals in the field, so GP practice staff, other VCS and statutory partners to hear their views on how we're doing as a service, to see if they've got any particular feedback for us. And we'd also like to start holding some service user involvement events, so to hear the voice of those people who are accessing our service, to understand how we can improve it to best meet local need. Okay, so I'm going to just go through a quick case study, again, hopefully to bring this to life a little bit. So we've got Stephen, who's a pseudonym for confidentiality reasons, someone who was referred to us via their GP, feeling stressed and anxious due to a number of different issues. So heavy workloads, a recent bereavement, but also pressures of parenting a young child during COVID-19. And I think those 3 issues are probably quite representative of a number of people that we've supported. So having been signed off sick from work, Stephen and one of our team worked together to produce a goal for Stephen to return to work with a new mindset. And he was able to identify that he needed some support around taking time to relax himself, and accessing resources and tools to support his mental health. So the support we were able to offer included signposting to a number of different things around music, meditation, and the Recovery College. We also had a discussion with Stephen about time and stress management, scheduling in things for his daily routine, relaxation techniques, and also getting motivated around physical health, which, as we know, has a really strong link with mental health as well. In terms of outcomes, Stephen returned to his job, reported that he was enjoying work again, and was able to structure his day with some helpful things for his own well-being. He felt better able to manage his workload, and did some things that he enjoyed. And one of the key indicators was that he had an increased well-being score, which moved from 18 at the start of the intervention to 32 at the end. And just for context, we would describe anything plus 3 points and above as significant change. So there's a 14-point increase on well-being there. Okay, so this is some feedback from our service users. I'm just going to leave that slide hanging for 15-20 seconds just for you to have a look at some of that feedback we've received. So this is, like for many other services, this is why we do what we do, to support local people with their mental health and their well-being. Thanks, Madeline. This is just to run you through the list of GP practices that we work with across the borough, detailed via their PCNs. Mm-hmm.
I noticed you don't have the Rose Hill surgery, which is missing. It's one of the largest surgeries for Wokingham and Winnish.
I think, yeah, it's on the one that was sent prior. Yeah, perhaps it's not showing. Okay. Hopefully we have got all of the right practices on the slide there. So yes, that's just to show you the spread of practices that we're working with. Okay, so the second half of the project is supporting the local voluntary and community service. So we facilitate 2 events in the local area, and the ultimate aim of these is to really bring together the voluntary and community sector, supporting people who are accessing support for their mental health and well-being. So firstly, we've got the Mental Health First Aider Forum. And this is a quarterly meeting that we facilitate for those who are trained in mental health first aid. So that could be professionals or could be other residents across the borough. And it's an opportunity to connect, refresh their skills, share knowledge and experience to support local people. We then also have the Mental Health and Wellbeing Community Alliance, and this is a bi-monthly meeting for the voluntary and community sector, with representatives from across different organisations who are focused on mental health and wellbeing needs, challenges and successes. Okay, so the First Aider Forum around mental health, we've held 5 of those so far. We aim to have quite a flexible structure and hope to be led from within that group. We really encourage participation and involvement from the different mental health first aiders, and it's an opportunity for peer support, case reflection and skills refreshment. We're also trying to support some of those members to do peer support between meetings as well, online and in smaller group meetings. And then we've got the Mental Health and Wellbeing Community Alliance. We've held 6 meetings so far, bringing together different VCS organisations. We've covered a number of topics, so things like the return to in-person, face-to-face working following lockdown, supporting those who may be experiencing mental health crisis, as well as mental health peer support in Wokingham. And in future, we'll be looking to hold bi-monthly reviews of the emerging trends and patterns for mental health and wellbeing locally. Okay, we're very near the end. This is a bit about future development ideas that we've got, that we've been discussing with our commissioners. So in Oxfordshire, as part of our charity, we provide some short courses and peer support. So we're thinking about offering that in Wokingham as well. And that could include courses such as exploring self-esteem, managing stress, and then more generalist 5 ways to well-being. And then in terms of peer support, we could offer things like an art group or a music group, or more general, again, perhaps tea and chat groups where people can come together and discuss how they're doing with their mental health and gain some peer support that way. Okay, that's the end of the presentation, but I'd be happy to take any questions and answer them as best as I can.
Oh. Councillor Rance, please.
Hello. There's a big area you've got there, and I see you say 100 referrals, was it a month? So how is that going? I mean, you haven't got many people to do it.
Yeah.
So how's that spread?
Yes.
Must be a big workload for each person.
It can be quite a big workload, absolutely. And actually, one of the administration kind of demands is to make sure that we are contacting our referrals as quickly as possible. And I've been discussing that with the project manager, and she, I think she feels that we're pretty much at our sort of upper end of the limit. So we are managing, but I think if it were to keep on going up, we might have to have a discussion about how we, whether we can fund another role or how we best distribute our work. Yeah.
And you've all got supervision opportunities.
Yes. Yeah, absolutely. Yeah.
Also, I noticed that it says face-to-face, and then there are videos and that sort of thing. But face-to-face is better because you can sense what somebody's feeling if they don't actually say it. Then further on, I see that you've got moving back to face-to-face working. So what's the proportion? I mean, at the moment, is it just one face-to-face and then your video, or what is the proportion?
So the proportion exactly, I'm not sure, but I think it would probably be, I'd say probably at least around 50% would probably be in person, based within the practices. And so when it says about returning to face-to-face, I think that was one of our sessions probably 6 or 9 months ago, following the lockdown, to just ask different organisations, how are you managing this sort of return to in-person work? But yeah, we do quite a lot of in-person and then some telephone and video.
Which must make them feel more valid, because if you, on a video is not as good, is it? Okay, one more question.
Sure.
I've noticed there's no practice, you're not working in a practice in Shinfield. It just says Swallowfield, but there is a Shinfield practice as well.
Okay, I will.
Which is my ward, so it'll be quite handy to know.
Okay, I'm sorry, Madeline just helped me out. I think it's under a Reading rather than Wokingham Borough.
Thank you very much. Thank you.
Councillor Phil Cunnington, please.
Sorry, let's put that on. Okay, just want to get a sense of things. You said that you're looking at 1,000 referrals, and you said that that's about capacity. From your referrals of 750, you had 550 initial assessments. So what's happening to those 200 between referral and assessment?
Sure. So we've been doing this service for some time in Wokingham, but also in Oxfordshire, and we would generally expect about an 80% attendance rate at our first appointments. That could be for for a number of reasons. I'd be interested to see the GP statistics on attendance rate as well, and I wouldn't be surprised if it was similar. So yes, there is a bit of a gap, and actually I think what we could be doing when I talked about the service user involvement events is start to ask, okay, we can see this gap between referrals and initial assessments. How can we as a service help you to attend, more regularly? Is it that we need to send a reminder, either via the GP or via our own system, an email or a text or something? But yeah, you're right to point out the gap, but it's something that we've noticed for some years actually across our service.
So what's the average time from the initial assessment to their first session of intervention with you?
Sure. It would depend on the PCN. So in some of the PCNs, there's perhaps more of a balance towards sessions there. So I think in our in Early Plus, we're very much in demand. So I think it would probably take maybe 2 to 3 weeks for someone to see someone. But then in other PCNs where demand is lower, I would expect that perhaps even within a week, we could begin to see people.
Fantastic. With regards to, obviously you have criteria for people that are suitable for your service. What sort of risk assessment are you running earlier, and do you review those risk assessments during treatment, or is it just at the start?
Sure. So we would, in our initial assessment, we have about 45 minutes with someone. So we can quite quickly pick up with them what the need is. When you mention risk, you're absolutely right. If we're concerned about someone's safety or the safety of another, we do in all cases, we do a confidentiality statement at the start to say to the individual, if you raise something with us that concerns us about you or someone else, then we may have to share that in a wider sense, perhaps back to their GP. But if they start to talk about things such as suicidal thinking, then we have a protocol that we use that gives the wellbeing workers steps to go through to help ensure the safety of that individual.
Okay, you record that risk assessment at that moment and then you review against it?
It would be in the session notes, and that's come up so the wellbeing workers themselves could look back on that in terms of the next session and check back in with the individual. Okay,
because I'm interested in the sorry, do you want? I'm interested in the interventions, not so much the content and the way that you work, but thinking about the people, the wellbeing workers. What training do they have? Have you got any wellbeing workers, for example, with lived experience that they can bring to help?
Absolutely, yes. So in terms of the role itself, it's not a qualified role, as it were. So it's not a clinical role, but we would take people from a number of different organisations. So just off the top of my head, we've got someone in that team who has got experience with the Samaritans. So they bring a lot of experience around supporting people in particular moments of distress. And then we also do in-house training as well. So we try to put people through the mental health first aid training themselves. We have training on things like domestic abuse as well. So they're able to pick up some of the signs of that early on. We do things like active listening, motivational interviewing training, to really support them in that one-to-one work that they're doing with people. So in answer to your question, there's not a set sort of specific background that we need people to come from. It's really quite varied.
Okay. With the people in intervention, are they all completing? Well, you're giving 6 sessions, you say in here. Are they all completing, or are you finding people are dropping out because they're starting to feel better? And what sort of rate is that?
Sure, I couldn't give you the exact numbers off the top of my head, but we do certainly have people who will drop out, who may, like you say, may have one session and feel like actually I've got all I need, and we don't hear back from them again. We do have a fairly good rate of completing the end of session sort of questionnaires with people, but we do see some drop off for sure. I couldn't give you the exact figures, I'm afraid.
Is that all right? Or do you want to? All right, sorry.
Thank you, Chairman. There were two things I'd like to ask about. One was looking at page 76, which breaks down by age, the people that are referred to benefit from what sounds like excellent services you're offering, and thank you very much for everything that you're all doing. I was just surprised that only 8% are in the 18 to 24 bracket, because we've often been made aware that younger people are suffering hugely with mental health issues. Why is it that, well, is it that they're not being referred, or is it that, you know, they don't want to be referred?
I think it's a really valid question. And as I said, we've been doing this in other areas, and we have seen in some places slightly higher proportion of younger people. So I don't know exactly why that is. I know that we have, as Mind in Berkshire, we've just run a recent conference for children and young people's mental health. So we know that there is the demand there, and there's that sort of energy locally to do something positive. But yeah, we're not seeing the big kind of percentages that we might expect to see.
Is that under 18s you were referring to, though? When you said children and young people, that would be...
So generally, probably up to 25 be for young people.
Oh, you class them all together?
Yeah.
Oh, I see. Okay, and there's just something else I wanted to ask about was the breakdown by the home address, that 94% are from Wokingham. Just to understand a bit more about that, why is it that in other boroughs they're part of this in the same way that we are?
So I think,
but there's just not the same take up.
That would be, so I mean,
looking at page 72.
Thank you. Thanks. Yes, so the other boroughs, I guess we would expect them to be a lot lower due to the way the service is set up, to be mainly via the PCN footprint within Wokingham Borough. But some people will be registered with a practice in Wokingham, but living outside of the boundary of Wokingham. So that's why the numbers aren't quite 100%.
Okay, I think I misunderstood what data you're presenting.
Sure.
So can I ask a follow up on that and say, because obviously you're presented as Mind in Berkshire, but telling us about Wokingham.
Yeah.
So do you offer the same service in other borough councils? And if so, is there anything that those borough councils do to support you that we could be doing here?
It's really appreciated. We don't actually run the service in other boroughs across Berkshire. Wokingham has been the sort of trailblazer for us, as it were, which has been really positive, because actually we've noted that Berkshire doesn't have its own Mind, or hasn't for some time. So that's why Oxfordshire Mind is sort of putting some resource into Wokingham, as well as Buckinghamshire Mind as well, actually, to form this sort of Mind in Berkshire initiative. But yeah, Wokingham is very much at the front of the queue in doing this work. Yeah.
Councillor Andy Croy.
Thank you. Thank you very much for giving us advance sight of the presentation.
Mm.
I think, if I'm right, that isn't the service funded by the donation from the guy who lives in Remenham, and the purpose of the donation was exclusively to fund this service in Wokingham Borough. So that might explain why nobody else is doing it. So following on from that, if that is correct, I've assumed that's correct given the timings. Okay, so do you know if any due diligence was done on the source of that money? Because nobody has made money out of Russia in the last 20 years without having some degree of acquiescence from the current regime. So that's question number one, was due diligence done on the money? The second question is the initial press releases that came out said that I think the referrals will be about 1,000 p, and it's great to see you're on target. for that. But it also said the funding was for 18 months. Now, there is a part of the report which, on my reckoning, means we've just run out of that initial funding. Now, there is a part of the report which says next year. But are you expecting to deliver the same level of service, given that the previous 18 months have taken £250,000? And if not, are you looking for other funding? And perhaps going back to what Alison was saying, are you approaching the Borough Council for the, I think, £166,000 a year annum you would need to sustain the funding at the same level? Sorry to have so much in one go. But
That's quite okay. No, thank you for the questions. I'll answer the second one first, if that's okay. So we've just some good news. We've just recently been successful with applying for funding with the council, with some of their prevention funding to take us through for the next 3 years, and I believe with a possible plus 2 years after that. So we've got some longer term funding in place. So it's, yes, so 3 years for definite, and then I think it's a 2 year plus if we, if we can show that actually we're providing something good. Yes. I believe it is at the same level as it was funded initially. Yeah. And the second part of that question was about the referral numbers. Yes, we would expect to be working at about 100 referrals a month, given the past couple of months that we've had. The first question, I'm not trying to elude it, I'll be honest and say that it's not something that I am aware of. I guess that question may be better sent to the commissioners of the service. I don't know if one of them is on the call or not, but yes, I don't know the answer to that question.
Yeah, I think Ingrid would like to make a point. Ingrid, would you like to comment?
Yes, thank you, Chair. Good evening. Just to clarify around the funding, so I think that the pilot work that was done with this service was initially funded through donation, but it's now fully funded through the Better Care Fund in the integration world. So that funding is no longer part of this service, just for clarification.
Was that helpful, Andy?
So I presume that means the first 250 has been spent on the service.
Ingrid, do you want to come back on that, or?
I would have to come back to you with the exact spend, but yes, I presume that I'm not entirely sure if that donation was spent in its entirety on this service or whether it also funded other areas. It was, I'm afraid, before my time at Wokingham, but I can certainly go away and find that detail if it would be helpful.
Yeah, please, it was in January 21, I think it was announced.
Will do.
Phil, I think you had 1 or 2 more questions, but sorry, before that, Rochelle, sorry.
You also said that you're doing all this service right now. What about the voluntary counselling services, which have counselling students and counsellors on, like ARC in Wokingham, or number 5 in Reading, or number 22 in the Royal Borough? How does this compare? Is that the reason they don't need you, because they have the voluntary services doing the same work you're doing?
Sorry, can I just clarify? Do you mean how do we work alongside those services that you mentioned?
You mentioned that you were working only in Wokingham, and you weren't working anyplace else in Berkshire. I was just wondering if the other services were taking up the slack, taking up the same work you were doing as a voluntary service rather than a paid service like you are.
Sure. I think, I mean, our experience is only in Wokingham, because they're the council that have come to us to ask us to provide this based on our work that we've provided in Oxfordshire. So I'm not entirely sure if other councils are feeling that they don't kind of need the support, or whether it's just that we're kind of quite new in Berkshire, and actually that in time we will start to expand. That's very much our hope, is to expand into other areas of Berkshire.
Are you working with ARC in Wokingham as well? ARC is one of the voluntary counselling services in Wokingham.
I think if they may well have been to some of the voluntary and community sector alliance meetings that we've held. My colleague Claire, as I mentioned at the start, is overseeing that, so I don't know the exact membership of that group. But if that's of interest, I could certainly get back to you. Brilliant. I will liaise with Madeline to get your details if that's okay. Thank you.
Phil, a couple more questions, maybe.
Thank you. We could spend hours. I actually wanted to refer back initially to something that Jackie Ranch said, that you are currently working with people on video. My experience, which I can declare is in another county, is that recovery on video for clinical treatments is actually better than it is face to face, and so is attendance, because you don't have to take the afternoon off work to get to an appointment and all that sort of thing. So there's many different ways to look at it.
Yeah.
Well, you say that you've got about 50% coming back to video. Are you expecting to continue with the video delivery, or are you going to work back towards face-to-face completely?
I think given what we've experienced during COVID particularly, we've learned that actually I think we need to keep all three options open, so face-to-face, video and telephone, because what we're trying to do is help to ensure that people can access the service, as you rightly say. For some people actually doing a phone call in the morning means that they're more likely to attend than a face-to-face appointment. So yeah, we're very much planning to keep all three options open.
Okay, and on that, I've got one more question. It's not going to be a question. I just will say that I've been very impressed with the way that the service has developed. The local primary care IAP service is struggling to recover its referral numbers after COVID and isn't meeting target at the moment. So it's good that you're getting an increase in referrals. I don't know whether those two things are linked or not, but they are. And I'm really pleased to see that you've been contracted, and look forward to more good service over the next few years. Thank you.
Thank you very much. Thank you.
Thank you very much for your questions. Thank you very much for your presentation. Thank you very much for actually delivering to our residents, which is really crucial. I do also support Phil's comments. We hear positive news about this service. Thank you very much. Maybe just one or two small questions before we close from my side. Sure. Do you feel you get different levels of engagement with different GP practices? And do you try and stimulate some of the practices to work in a sort of best practice way?
Yes. Yeah. So our experience across the project is that some GP practices will refer really well and really often. Other practices we've had to work quite a lot harder to engage. So, we try and attend team meetings at practices, talk about what we do, how people can refer, and we are seeing some fruit from that, but some of it is much more of a slow burn than others, that's for sure.
And final question, you talked a little bit about capacity and potential constraints, and you're close to your sort of maximum level. How do you think you can grow your capacity?
I think there's one or two things that we could look at. So I guess the obvious first one, I won't be too embarrassed to say that more funding would mean that we can employ more people to do the work. The other option that we have thought about is that for very specific tasks, so perhaps some of the referral coordination, we might be able to get some voluntary support for that as well. But again, longer term sustainable thinking, we may need to expand the team in future.
Brilliant. Thank you very much for your presentation.
Okay. Thank you.
I think the next topic, according to my agenda, is Berkshire West vaccination plan. Madeline, who's presenting on that? Don Reeves. Sorry, Joe. Welcome, Joe. Thanks for joining us. The floor
Thanks
is
for having
yours.
me.
Please go ahead.
Brilliant, thank you. So my name's Jo Reeves. I'm the Newbury Locality Manager for Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board, or any other three-letter acronym that you might want to put alongside us. Alongside my Reading and Wokingham counterparts, we have prepared the document which is provided in your packs, which pulls together in one place the planning for the autumn COVID vaccination programme. I will assume that members have read the pack, if that's okay, and just provide a brief introduction before moving on to questions. So the document was adopted by the Berkshire West Vaccination Action Group, which is chaired by Susan Parsonage, and I'll just summarise some of the updates that I'd like to add since this was submitted in your packs. So first of all, to mention that invitations to book autumn booster vaccines have been going out centrally from the NHS via text and letter to many of those eligible, and the national booking system is open to over 65s, frontline health and social care workers, patients who are pregnant or at higher risk from poor outcomes with COVID-19. Primary care networks are prioritising patients in care homes and those who are housebound, and they are co-administering with flu vaccines where practicable. There is a draft vaccine inequalities plan which was presented to the Vaccine Action Group last week, and that plan identifies priority groups for community engagement, targeted communications and the Health on the Move service, so delivering vaccines in very small community venues where appropriate. In terms of overall coverage in Wokingham for COVID vaccinations, we've got PCNs on board and a small number of pharmacies operating at low intensity. So as mitigation and to reinforce the COVID vaccination supply in Wokingham, Oxford Health are going to continue the outreach service, which I understand moves to the Civic Centre shortly, and they will be operating that 2 days a week. In terms of monitoring performance of this round of the COVID vaccination programme, the overall national target is to see take up of 75% of those eligible, which we will be monitoring and providing data reports fortnightly, which will be interrogated at the Vaccination Action Group, but also submitted by email to each of the local authorities to review in further detail. So I've gone for brevity, but I'm really happy to take any questions if any more details required.
Rochelle?
From personal experience, the NHS website said a lot of places were first come, first serve, just come in and do it. And my own personal experience on 2 different places that were supposed to be taking walk-in appointments weren't. That everything was by appointment. Can you please correct that so it actually says by appointment only? Because it's a pain in the neck to drive to someplace to get to somewhere and find out, oh, the NHS site was wrong. I tried ringing and the phone took forever to do anything and never quite got through. So it's just a very unwell thought out as far as that goes. If you're going to change something, please change it on your website as well. I actually did get this, the jab, but it was by accident only because somebody canceled. It's not exactly the service you want to have.
Yeah, I appreciate that's frustrating, and the feedback I've certainly had has been that often providers will try to vaccinate a patient on a walk-in basis if they're able to, but often they might be needing to keep their vaccine supply back for booked patients. But I can appreciate the mixed messages would be really frustrating. So certainly we'll feed that back to NHS Digital, who manage the website.
I think we have a question from Pauline Jorgensen.
Thanks. Thank you. Yeah. A couple of questions, actually. Firstly, having read this presentation, I was a bit confused about where people would actually be able to get inoculations from. Reading Town Centre isn't very convenient for a lot of residents in Woking Borough. And to be honest, neither is Woking Town Centre particularly convenient either. It's sometimes quite difficult to get to. Will they also be able to get inoculations at local chemists and from their GPs, or is that the only two options? That was the first question. The second question is, I recall from the last lot of COVID inoculations, we had a gap between age, I think it was 17 and 19 or something like that, where the school inoculation service weren't doing it, and neither were the COVID centres. I'm just wondering what the provision is this time.
Yep, so there are a number of providers offering in Wokingham, including PCNs, as I mentioned, some pharmacies. There's the outreach service run by the team who look after the Broad Street Mall in Reading from Wokingham Town Centre. So the NHS target was that there should be access for everybody within a 30-minute drive. But actually across Berkshire West, the vast majority of the population has access within a 15-minute drive. I appreciate not everybody drives, but we are satisfied there's good geographical coverage over Wokingham with Oxford Health Service as mitigation for some kind of lower intensity pharmacies, compared to some in other parts of Berkshire West who are essentially running at the intensity of a mass vaccination centre.
It would be useful to get a list at some point, I think.
Okay.
That would be helpful, thank you. Because I read the first sentence as all PCNs are covering older people's care home residents and housebound patients, as they weren't covering anything else, and that's obviously not correct.
Yeah, you're right. They are prioritising in the first instance those most vulnerable patients, and many will be moving on to wider groups in due course.
Thank you. And the question about the 17 to 19-year-olds, or whatever it is, the ones that had a gap last time?
Yeah, I'm not aware of the gap last time. Forgive me, I wasn't as closely involved, particularly in the Wokingham picture. So in respect of autumn boosters, I'm not aware of any issue when it comes to particularly 17 to 19-year-olds. So
I think Matt might remember it. The issue was that the school vaccination service cut off before the age that the external vaccination people picked up, and there was a gap.
Yeah,
I think Ingrid will remember. I think the detail more than me.
No, that you're
it's nice that you think I might.
No, you're absolutely right, Councillor. That was the case for a period of time and then corrected. The autumn booster isn't available for that age group, so it won't be a concern this time round. The autumn age group is for older age groups and vulnerable population only.
Okay, so why does it talk about 5 to 11-year-olds?
So they're getting their that's not the autumn booster jab. That is their dose 1 and dose 2 of the 5 to 11-year-olds. So there's different programs. It is incredibly confusing, and there are different programs running alongside each other at the same time for different members of the population, depending on age and vulnerability. But yes, our centre, we have a really good uptake in Wokingham of 5 to 11-year-olds, and it continues. So we're really keen to keep that offer going alongside the autumn booster offer.
Great, thank you. And presumably, why do the 17 to 19-year-olds or whatever not get a booster?
So the booster this time, as agreed by JCVI, by centrally, is for similar cohorts to those that get the flu jab, or similar cohorts to those that got that first round of vaccines all the way back when. So it's over 50s with a health condition, over 65s, those with pre-existing conditions, those in health and social care. So it's that kind of population rather than the whole population. Although that said, we'll wait and see, because if we actually don't get that much demand, it may be that the government roll it out more broadly. But for now, that is the advice and who we're giving the autumn booster to.
Thank you very much.
Councillor Beth Rowland, please.
Thank you, Chairman. 2 questions.
I received a message to call my GP, make my appointment for both my flu and COVID vaccines, which I have on Saturday. And I'm very surprised that you said in here that 75% of eligible patients would take up the offer. I would have thought it would have been a lot higher in these age brackets and health-wise brackets.
Yeah, so that's the national target, which is in line with the national target for flu vaccination. You're right, we have enjoyed, particularly in Wokingham and West Berkshire, within Berkshire West, take up which far exceeds that 75% for the groups which you've outlined, those who are most vulnerable to COVID due to age or underlying conditions. So certainly our local ambition is that we see that again, and certainly we have enough vaccine to achieve that again. Just that's the national baseline, I suppose, that across the country we're working towards.
Alison Swaddle.
Thank you, Chairman. There's lots of targets in here, how you're going to tackle it. And you've set out, who's going to get the booster, so everybody over 50, and then people who are clinically at risk in households of the people likewise, and starting to roll out over 75s from the 12th of September. I have to say that, although I'm not yet 65, my local practice, Loddon Vale in Woodley, we got notice today inviting people over 65 to book, which is great news. What I wanted to ask is, what's the target to have completed vaccinating all these people? Is it the end of October, the end of November? When is it?
It's by Christmas. So there is a target that everybody who resides in a care home for older adults or who is housebound receives their vaccination by the end of October, and the remainder of the programme should be completed by the 24th of December.
Because it is called an autumn booster, and we're then into winter, aren't we?
We are. We await any further advice from the JCVI whether that programme should be extended throughout the rest of winter, or whether they might recommend additional vaccines. I'm not aware that any decisions have been made, but yes, you're correct. This is an autumn programme.
So might we make use of the mobile units that went out all over the borough? Because as Pauline said, for many people in our borough, getting into the centre of Wokingham or going to the Broad Street Mall isn't the easiest thing to do.
So the two vans that we have available to us are being prioritised as part of the inequalities element of the programme. So rather than just providing additional capacity to the general population, we're satisfied that there is good access for the general population to their autumn booster. What we're still working on is those who have never had a primary course of their COVID vaccination, and continuing to engage with those communities and bring the vaccine to them where we can. So that's really what we want to do, to make sure that our vulnerable groups who experience health inequalities, we're still offering the vaccine to them and trying to work with them on a sort of a more general health promotion basis as well, to build our relationships and ultimately try and combat some of those deep-rooted issues which cause them poorer health outcomes.
Councillor Phil Cunnington.
Hello, Joe. I would expect that the inequalities programme then, with those mobile units you're talking about, Reading, as a key area, or is there inequalities right across the borough, the Berkshire, that you're going to be looking after?
Yep, so we're working across Berkshire West in all three local authority areas on inequalities. Although Reading have had funding for a community vaccine champion programme, and there is some really good work happening in Wokingham to continue to engage with communities, and certainly that resource is available to be deployed in Wokingham, subject to the community engagement and identifying those communities and getting those invitations to come in with that programme.
Okay, because my experience of the last vaccine programme was that the more local you made it, the more people took it up. And I think that with Wokingham, some of it is quite rural, and that makes it difficult to justify putting it in somewhere where there's only 20 people to travel, but they've got a long way to go. So I would like to implore you to keep Wokingham in your mind, because if we do take it up as well as we did previously, you can get us out of the way and then concentrate back on Reading again.
Councillor Andy Croy.
Yeah, I think there's just a reply to Phil. I think there's plenty of equality in Wokingham. I'm sure the bus, I know the last time the bus went to Norris Church, for example, in your ward, so I'm sure it will be coming to similar sorts of areas this time.
Have we got any further questions from anyone? Just sorry, Beth, please.
Can I ask when we get a report back on the success of the programme?
I'm happy to come back when I'm invited, so I can liaise with Madeline about the forward plan for the commission, if you like.
Thank you very much, Joe, and thanks for agreeing to come back and see us. Just one question before you go. Obviously, social care staff in the borough do a really important role, and one that exposes patients and people in homes to situations if they're not vaccinated. How are you going to try and ensure that the social care staff are vaccinated?
Yeah, I think that's where, yet again, communications is really important. So there is a Bob-wide communications plan for our our broader population-wide messaging, and what they're doing as well is creating us templates that we can use locally. But we've got a lot of support from the local authority communications teams to support us with relaying some of those messages. There's a barrier removed in the sense that frontline health and social workers can self-declare. So rather than waiting to get an explicit link to book their appointment, they're just able to go ahead now and self-declare that they're a social worker, so that they can access a vaccine at a location and a time that's most convenient to them. But yes, the comms plan that I've seen a draft of but not yet had a final version will be picking that up, and I hope that we continue to have Wokingham Borough Council support to reach those social care workers, those directly employed and those through commission services.
Thank you very much, Joe, and hopefully we've not put you off coming back to see us again. Thank you.
Thank you for having me.
Madeline, I think the next item is Health Watch. Sorry, who's presenting that? Oh, Sarah Deason. Thank you very much for joining us. Welcome to the meeting. The floor is yours.
Thank you very much, Councillor. So I'm just going to share, I've just prepared some very brief slides just to support what I'm going to say. They weren't in the pack, but I just thought it'd be helpful to have the visual alongside the verbal. So let's get going. So yes, my name's Sarah Deason, and I'm actually the Business Development Director of the Advocacy People. We are the new host provider for Health Watch Wokingham Borough, and we started the service on the 1st of April. So I've been seconded really to Health Watch to work alongside my colleagues there to get the service up and running. So just to recap, I just wanted to just go back over the role and remit of Health Watch. I'm not going to read through all of it, but basically the role of Health Watch is to collect the public voice, find out what's going on in health and social care locally in Wokingham Borough, and then we feed that into to health and social care services and decision makers to improve services, and also to feedback on good work as well, because there's a lot of negativity around a lot of services at the moment. So there is some balance, but obviously the main focus is to bring forward improvements and that the public voice is included in that. So that might be that we attend meetings where we raise questions. So, for example, if changes are being made and there's no evidence of the public being consulted, then we will make sure that the views of the public are heard. We will share either collectively or individually the patient stories and patient feedback. So it might be that there's an individual who we support to ask questions, but also Healthwatch is very much about the themes. So we would look at themes and the recurring things that are coming up time and time again, and then we can take action on those themes and feed those back as well. Another important part of what we do at Healthwatch is to help people find out about local health and social care services, and then formulating the views on the standards of provision, how things can be improved. As I say, that's part of the role, and then we can make Healthwatch England aware, so we can escalate up as there's a Healthwatch in every a statutory service in every local authority area, so that can all that data and that information can be fed into Healthwatch England for the big issues, which can then link into places like the CQC. So in terms of where we are, we took over the service, as I say, on the 1st of April. As can sometimes happen with TUPE, the 2 staff that were employed on the Healthwatch Wokingham contract with the previous provider chose not to TUPE across, and that was only a week or 2 before the service was started by us. So our focus, and also no volunteers, or only 1 or 2 volunteers transferred over as well. So our focus very much has been on getting paid staff and volunteers in place to run the service. We've got the office in the Wokingham and Charity Community Hub, which makes us more visible. What we found was that the awareness of Healthwatch Wokingham Borough was quite low. We did a poll online, and it was around 50% of respondents were aware of Healthwatch Wokingham Borough. And we found that even though the email address and phone number have remained the same, we weren't getting a lot of comments and questions and feedback from the public. So we've really focused on that networking with the voluntary sector, statutory services, and sharing information to the public as well, so that people are aware of us, and we are seeing that paid off. I've just checked the data for this quarter that we're coming, the second quarter, which we're coming to the end of, and we've seen a steady uplift in the number of inquiries we are receiving. So there's positive feedback that we're doing that. One of the key things that we do is attend meetings like this one, the Health and Wellbeing Board. What we found is that there are the 3 tiers of meetings. So there's the Wokingham Borough ones, there's the Berkshire West ones, and of course with the new ICS, ICB, ICPs, there's that extra level within Buckinghamshire, Oxfordshire and Berkshire West. So what we're finding is that there are lots of meetings coming up, and that's impacting on our capacity. Having said that, what has actually happened is that the advocacy people are now running separate contracts, but all 3 contracts for Healthwatch across Berkshire West. So what this means for Wokingham is that we can provide economies of scale in terms of sending 1 person to that meeting. They'll be well briefed, obviously, with the issues for the particular area, but we can then be more present at different things because we can use those economies of scale for Berkshire West and for Bob meetings as well. And then as we move on, we'll be looking at our projects. We've already started identifying some priorities. Obviously, things are moving goalposts in terms of certain things. There was one piece of work that we were just starting on, and then events superseded it, so we didn't pursue that. We're just keeping an eye on that at the moment. So yes, we'll be looking at enter and view and looking at what we need to look at locally, and then as we do all the whole time, underpinning that is the information and signposting for local people. So that was what I wanted to say, and then take questions. Thank you.
Councillor Andy Croy.
Sorry.
Oh, sorry, while
Oh,
Beth is doing a question.
Maybe that's your question. Yeah.
My question is very quick. Please, could you provide us with what we've seen on the screen or not seen on the screen, because we're either too close or too far away to read them, so that we've time to prepare for the meeting in future.
Yes. Oh, yes. In
So
future,
we
I
have a
will.
written
Yes.
report.
Yes. Yeah. Yes. So it was going to be a verbal update, but last week I was asked just to prepare a couple of slides. So no problem.
Thank you.
Sorry, Councillor Croy.
Give me 2 seconds. I'm just looking something up. Excuse me. Would you be able to put the first slide up, please?
The first one with information, or
Yeah,
the first
summary of there was a bunch
summary.
of
Yes.
Yeah, that's right. Yeah. Okay, thank you very much. Okay, so first of all, thank you for your email that you sent to me in August, inviting me for a chat about a Twitter exchange that we had. So I didn't take you up on the offer because I knew you would probably be coming along to a meeting like this. So I'd just like to sort of repeat my question again. At the time, your Twitter account said it was advertising for, I think it was good news, positive stories, and it used the hashtags Thankful Thursday and Positivity Matters. Now, my understanding of Health Watch is that it is there to try and hold local health services accountable and encouraging an attitude where we're somehow grateful for things which are being paid for and things which, it isn't really the right sort of frame of mind. And I'm just wondering why the current Health Watch has that sort of approach, because that to me is the opposite of scrutiny. Being thankful for something is not something you can do when you're scrutinising things.
I think that Health Watch England are very clear in terms of what they expect from local Health Watch, and they do very clearly say that we want to hear good and bad experiences of people. Of course, when things go wrong, we want to hold people to account, but also there is a role there in terms of sharing good practice and celebrating the things that are not necessarily celebrating, that's probably too strong a word, but sharing positive experiences, because they can get drowned out when so much is very difficult within health and social care. So it is within the Health Watch remit to collect good experiences, and but that doesn't stop us from being able to amplify and talk about the things that aren't right, and there's a balance there which most of the time is around improvement, but improvement is based on good experiences as well as changing what's not going well.
Because I looked at the national guidance for Health Watch, and I haven't read the whole document. I've looked at the introduction, but I can't find that emphasis on amplifying good experiences. I do find lots of comments which again all lead back to scrutiny and holding to account.
They do.
So I guess my fear is you seem at the moment to be too keen to be positive at a time where almost everybody's interaction, apart from the staff, who everyone thinks are great, with all aspects of the NHS, is that it's underfunded and under-resourced, and it's on its knees, and it has been for several years. And anything which sort of gets away from that message is probably undermining the general need to improve funding.
We're talking about one tweet in the grander scheme of all the work that we've been doing. It's something that we did share because, as I say, we do want to hear some of the good things. We're acutely aware of all the difficulties that there are in the NHS. But also we're acutely aware that there are a lot of staff working very hard in the NHS, and sometimes they appreciate hearing the good things. And so if we do get positive feedback, and we do get positive feedback, we make sure that we pass that back to the people that it's about as well, because we want to it's part of motivation of people that they hear when they really run into the ground that there are still pieces of good practice. But in no way do I consider that undermines the bigger picture. It's just providing that little bit there, and as I say, most of what we're doing, the project that we were going to do, it's all about the themes, the difficulties. There's a lot of work that you won't see. The tweet is obviously public, but there's a lot of work that we've been doing for individuals, and a couple of groups of families have come to us as well, and we've been working individually there, raising those issues with things. So the balance, there's the one tweet on that hand, but all the other work behind the scenes, and the individuals that we're working with, and when we go and talk to other organisations and things, that's all very much focused on what can improve and what can be done better.
And one more. Okay, so changing topic completely now. Obviously, the issue of access to GPs is a massive issue all over the borough. I'd just like to ask about the actually it's my own personal GP, but it's I'm not asking for my own reasons. Is the GP in Norwich, and or rather the lack of a GP at Burma Hills. So I'm just wondering, what have you been able to do in terms of pressure on the people who run the main surgery in terms of getting a GP there? Because as a patient
in Burma Hills, it's not something that's come back to us through our feedback so far.
Astonishing. I'm astonished. Okay.
Yeah, no, honestly, there is that. Yes, it's not. That's not. Yeah.
Okay. Well, then fair enough.
Yeah.
Okay.
Sorry, Councillor Alison Swaddle.
Thank you, Chairman. Looking on the website for healthwatch wokingham.co.uk, I wanted to understand more about who advocacy
The advocacy people.
for people are.
Mm-hmm.
And there is a section, our board, but there's no information about who's on your board. Could you tell me some more about that?
Okay, so the original Healthwatch Wokingham Borough was the CIC. So they had a board who ran the CIC and were the advisory group for the Healthwatch service as well. We have a different model in that our advisory groups at a local level aren't involved in the governance of a charity. So where it's the CIC, obviously they've got the charity governance and that side of things as well. With the advocacy people, the charity board and governance is our charity board. So that all that information is on the website for the advocacy people. So in Wokingham Borough, we will have an advisory group of volunteers who are there to, well, scrutinise the work plan that we're putting together and how we're working and what we're doing. No volunteers transferred over from the previous provider wanting to take on that role. So we are currently in the process of advertising to create that advisory group who will provide that scrutiny for us and that guidance.
Okay, could I ask that you do update your website? Because I think it's very important that it's open and transparent who's running this, who's involved. You know, you've got what we do, and there's a section that says our board. You can find out more about our board below, but I couldn't find out any more about it. So.
Yeah, it's because it's the Healthwatch board, and there currently isn't one, as I say, because we're in the process of recruiting. So it's different.
It does openly say Healthwatch Wokingham Borough is provided by the advocacy people, and it's got your charity number. But perhaps you could just add a link to we can understand our residents who want to know who it is they're talking to. And I'd just like to wish you all the best with the work that you'll be doing. You've got big shoes to step into. I think we all look forward to hearing from Healthwatch at each meeting. You know, they really got out there, talked to lots of people, highlighted what was going wrong. And as a result, we then looked at some, we brought the NHS in. They highlighted mothers in Wokingham were not happy with the maternity services. And then this committee, you know, we called the maternity department of the Royal Berks to come and speak to us about that. So please do get out there. encourage people to know that you're there to support them, you help them make complaints, and bring it back here so that we also can champion our residents and their concerns.
Absolutely, that's what we're doing and will continue to do. Just on the point there about helping them make complaints, a distinction between Healthwatch and individual advocacy is that Healthwatch does support individuals in a more of a light touch way. We're looking more at themes and patterns. An individual NHS complaint will be supported by the advocacy people with the independent health complaints advocacy. So if you'd like me to share some information around that, then I'm more than happy to do that.
Thanks a lot, Alison, for your statements. Appreciate those. I think we might have a question from Rochelle Shepherd-Debay.
You mentioned CIC. What is that? I'm assuming the last C is commission, but I have no idea what the C for C and I are.
It's a oh, now I've gone blank. It's basically a type of social enterprise. It's a social enterprise basically.
Community interest company, I think.
That's it. Yes, mine went blank. Thank you.
Councillor Phil Cunnington.
Yeah, I have the pleasure of working for a CIC, so I can help you. Thank you, Sarah. So I wanted to check, how many employees and volunteers have you got at the moment then?
So we've
In
got
Wokingham.
Sorry.
In Wokingham.
Yes. So we've got 2 employees in Wokingham and myself. So we've got 3 paid members of staff actively working on the service, and we've got 2 volunteers and a couple more who we are currently talking to.
Great. So I was wondering if there are any areas of concern that you'd already identified in the healthcare setting, or if there was any information you brought across from the previous service which needs particular attention at this time, so that I can get an idea of perhaps where your priorities are for reviewing in the next quarter.
So we didn't have anything handed over in terms of priorities from the previous provider. Their annual report is on the website, but there's no forward plan there, which is understandable. So we've been looking at different aspects, things like I mentioned maternity. We've got a conversation with somebody tomorrow about maternity. We've highlighted cost of living crisis, self-care, and the information for people in the public, the comms around the public knowing about the fact that the NHS isn't the same as it used to be. So the different roles that they might come across within their local medical centre, information about vaccines, things like that. Those are the ones that spring to mind immediately. GP access, dental access, obviously, are high up there. Yes, so there are a lot of different themes coming through.
Sorry, Andy Croy.
Thank you. I may have missed it because I had a short break from council last year, and I was just, and I appreciate you're the new provider, but if my memory serves me correctly, I think the last provider was paid either £10,000 or £12,000 a year. I think Matt Pope might be able to clarify if you don't know. I was just wondering what is the organisation's current remuneration from the council, and how long is your new contract for? Matt might know the answers to this if you don't.
Matt, do you want to speak? Yeah.
I'm trying. Can people hear me and see?
Yes, thank you.
Trouble with, hang on. Got trouble with my camera. Sorry, and yes, and well, the current value of the contract was same as the value of the contract before, with an inflationary uplift. So there's no change there through the procurement process. And now you're going to challenge me for how long the contract was. From memory, I think it's 3 years, and then there's a kind kind of option to extend if we want to. We did that with all the voluntary sector contracts, so that people had security of funding and knew where they were, because a lot of those contracts were rolled over year on year.
Thank you.
Reliably informed on by the magic of Twitter that it's 3 years plus 1 plus 1.
So, I think it's Phil next, unless somebody else has a question. Oh, sorry, I do apologise. Alison?
Yeah, I just wondered if dentistry and access to local dentists is high on your agenda.
Yes, that was what I mentioned in the list there. Dentistry is a really difficult one because we are very aware of the local issues, but obviously it's a national issue. So we're feeding back the local into the national, if you like. We have 5 Health Watch. My colleagues in Portsmouth have done a lot of work too, and it's the same issues. So yes, it's very much on our agenda, and it's been interesting that it hasn't come up on the work plans of other on other statutory plans. But we're certainly keeping an eye on that one.
Sarah, many thanks for coming to see us. We really appreciate you coming to see us, and we really hope that you'll give us regular updates. Obviously, we understand that you're transitioning the service, and you know, that has its own challenges, and we understand you want to run the service in a different way, perhaps around certain themes or topics, or I don't know what you'd call them exactly, but we would definitely like to hear about your plans and where you think you're going to add the most value to us as an organisation. Obviously, you can see from the questioning here today, we have some very experienced scrutineers who don't make people's lives necessarily all that easy, which is, you know, I think one of the reasons we're here, right? So thank you very much for supporting our questioning tonight, and I look forward to seeing you again. Thank you very much.
Yeah, thank you very much.
Okay, Matt, I think you're on next, Matt, if that's okay. Are you ready?
I am, yes, I'm ready, yes. I suppose firstly, just like to say, normally I'd be in face-to-face. I just couldn't make it this time due to private appointments, so just apologies for that, but I will be at each meeting face-to-face going forward. So it's KPIs report, isn't it? Quarter 1 KPI report. I think you've all got that in your pack, so I don't think I'll slavishly go through it. I'll probably jump straight to questions. I suppose all I would say is all of those KPIs need to be seen in the sort of context of unprecedented demand, really, post-COVID. And we've just been running through some of those figures. So safeguarding concerns up 76% in a year, front door contacts for adult social care up 35%, OT work up 50%, and number of community assessment requests up 55%. So those are quite alarming figures. Nothing unusual there in Wokingham. That's a national pressure on adult social care. So we kind of need to keep the pressure up on the future funding deal for adult social care, and also we need to create the workforce in adult social care to meet that demand. But I'm more than happy to jump straight to questions.
As Matt said, I think we've had the pack. If you've had time to read it and prepared any questions, or if you've got any questions following Matt's comments, please let me know. Sorry, Alison?
Could I simply say that on all the tables, because obviously we're just looking at the first quarter, it gives us nothing. I know we've got the graphs to refer to, but it would have been useful to just see quarter 4 for 21-22, just to see the figures. I'm not used to seeing it set out with, lots of blanks.
But you just let me might be easier
Looking at
for-
say page
I just
118, 119.
can you see my screen now?
Yeah, if you go to the next page.
These ones.
Yeah, so we've got, obviously, we haven't got quarter 2, 3, 4 for this year. But rather than having a blank space, we could have seen the previous quarters for the comparison.
This is here. Quarter 4.
On the graph.
quarter-
Yeah, I know, but I
Yeah.
would have liked to have seen the RAG and the directional change
on
and all the
here.
other
Oh,
information.
okay. I see what you mean. Oh, right. Okay.
Rather than
okay.
having
Yeah.
just blank boxes, I think we all know that quarter 2, 3 and 4 will follow quarter 1.
You're right. So I can get from the graph, I can take the number and put it in the box for next time. I can update that.
Yeah, otherwise, what I was going to say was, I know we have mentioned this before, that you are setting yourself ambitious stretch targets. And so I think I would simply ask, are you still committed to doing that?
I am, yes. I mean, against the backdrop of what I said before, that's getting harder and harder.
Yeah.
But I still think we should aim to have our targets in that space. Yes.
Good. I'm glad to hear that. Thank you, Matt.
Andy Croy.
So thanks, Matt. I just like, it's not about the graphs, but it's just about the 76%. I mean, that's an astonishing increase in right in the, sorry, in A1, a 76% increase on pre-pandemic referral. Why?
Lots of reasons. I think the single biggest reason is we're getting a lot of inappropriate referrals from the ambulance service, and this is happening across Berkshire West. So we're getting a lot of referrals that need sifting through that probably shouldn't have come to safeguarding in the first place, and we're doing a lot of work in that space through the safeguarding board and with the ambulance service. That's the single biggest reason, but generally demand is up across the board. Some of that is about awareness raising as well, but obviously getting the right referrals there mean we can respond quicker. If we get a deluge of referrals that we have to sift through and follow up, which aren't really appropriate referrals for safeguarding, it kind of bungles the system up a bit, and that's what we're experiencing currently.
Okay, so if some of these then are, so just to follow up on that, if some of these are basically referrals because the ambulance services are getting it wrong and shouldn't be referring them, what's then the underlying correct level of referrals? And I appreciate it will have to be an estimate.
Oh, what? I'd have to refer back, I think, Andy, for that. I'd talk to my head of safeguarding to get that. If they were weeded out, you're saying what's the underlying demand, aren't you?
Yeah.
Sorry to ask a stupid question, but what does the case from the ambulance service that's erroneous look like?
So again, if we want to have a look at some of that in detail, we can, if we want to get our safeguarding lead along. But some of those would be sort of, there have been referrals that are handwritten without information, missing bits of information, that sort of thing. So it's that sort of level of having to chase up, and obviously, if you get that, as a safeguarding service, you've got to make contact and try and find out the information, missing bits of information, whatever it might be. It takes time.
Thanks, Matt. Is this caused by what, a new recruitment drive in the ambulance service, or have they just run a safeguarding course, or what's going on?
Well, I think generally the ambulance service is struggling overall with demand, and I think it's part of that overall pressure on the service.
Thanks, Matt. Councillor Hare, you need.
Can I just make a comment? That is that hopefully sometime when we can find a date, we're going to have for all councillors a safeguarding session so that every councillor knows about safeguarding, can understand its purpose, things like that, and how it's going in this authority. Because I think we are all responsible, and that's important for all of us.
Any further questions for Matt? Oh, Andy Croy.
Does it matter where from? Can it be from anywhere? Or are we still looking at A1? No, I mean, in terms of, are we still asking questions about A1 or can we move on a little bit?
You can move on
Okay,
to other topic.
So AS2, that's very good news to get the waiting list down to 0. That's excellent. It says that you did this by redeploying people from other teams. So I'm sort of thinking, does that mean that there were knock-on effects in the other teams' areas? Or did we realise, I hate to say it, that they weren't needed in those other areas? Because you don't get anything for free, do you, right? I mean, there must have been a knock-on somewhere. So
Yeah, sure.
I would like to understand that.
Well, yeah, I suppose that there is a bit of that. I mean, what we do have is temporary flexible resource that we move around to help with pressures, and obviously we were having an increasing waiting list around assessments, so we moved them around there to help with that. But previously, those staff were paid for additionally from the NHS to help with discharge from hospital. But the NHS ceased that funding, so we, rather than lose those staff, we moved them across to help with our assessment levels. We won't be able to afford to keep those temporary staff forever. So once we've got the backlog down, we'll have to start trying to keep on top of that. But inevitably over the winter, things will creep back up again a little.
Councillor Pauline Jorgensen on the line.
Thanks. Matt, I was just looking at the long AS5, the long-term admission to care home. You're saying that the aim is to reduce it, but isn't this sort of in conflict with the aim of not having people blocking beds in hospitals? How are you squaring those two? Or am I misunderstanding it?
No, not really. I suppose there are two answers to that. There are different pathways out of hospital. People that go home without not needing any support, all the way up to people who go into nursing care. What we do very well in Wokingham is make sure as many people that can go home with support do as possible. So what we're trying to get at here is not blocking the hospital, but making sure people go home and they're re-abled and get back on their feet, and they have carers going in, and we've got enough carers to go in, so that only those that need to go into nursing care, residential care, do. You do have a good point though. There is a national issue which we are part of, where there are not enough affordable, certainly nursing home care placements, so that sometimes people are spending too long in hospital and could move quicker out of the hospital into those homes. There was an announcement, I think, last week, although I know there was an announcement last week about £500 million to create capacity for that. We await the detail, but obviously, if that's more money and it comes to social care, that will be helpful in that area.
So might I suggest you tweak this metric, because I think what you actually should be measuring is the proportion of people that can't go home, do go home in a timely manner, and you're in danger of driving the wrong behaviour if you just measure this crude measure, which is stopping people going into residential or nursing homes, where it might be the right answer.
Sure. I don't think we do that.
No, you probably don't, but in which case the metric isn't doing you any
I know what you're getting. It's it should be about having percentages overall into different routes and keeping an eye on that our percentages aren't getting out of skew, as opposed to overall numbers if there's capacity.
Yeah, that's exactly right, Matt. I think.
Yeah.
that would help.
I see what you're saying. I'll have a look at that. I'm always a bit hesitant to change things mid-year, but I know what you mean. Maybe we could put something in the commentary alongside that to start with, maybe.
Yeah, because otherwise you could make that look better by bed blocking, and that is not what we want.
No, it's certainly not what the NHS want. No, it's not the right thing to do.
It's not the right thing to do for
I know.
there either. So
But,
okay, I'll let you have a think about it.
Sure.
Sorry, thank you.
It's all right.
Chair, I would just like to
You,
say
one more question, Andy.
it's not a question. It's a I don't know what it is really. I forgot when I came in because I came in late to say that I work for a care home. Wanted to declare I work for a care home provider. Thank you very much. Yes.
A declaration of interest duly noted. Thank you. Any further questions on this topic for Matt? Okay, Matt, I think you got away lightly there. You survived. Thank you very much, Matt.
I'll be back face to face next time. Sorry.
Okay, hasta la vista, Matt. Thank you. Thanks a lot. The next topic, I think, is the forward programme. One thing to say before we do the forward programme, we had some internal meetings between Madeline and Ingrid and Matt, myself, and one meeting with Beth as well. What we're trying to do is we're trying to make sure that we align better and prepare a little better if we can possibly achieve that goal. I know sometimes it's impossible to prepare sometimes, you know, when we don't get the necessary documentation through in time and et cetera, et cetera. But we had discussions on forward plans, which I found useful. So there are a few topics that we're working on, which is helpful. Also, Ingrid prepared, I would say, a briefing note, which Madeline sent out with some sample questions and things on. But from my side, I would like to say a big thank you to Ingrid for preparing that. It's very useful if we have a briefing note before the HOSC so that we can see a bit of, you know, the undercurrent of topics and perhaps read a little bit in between the lines of topics. So hopefully you will get that briefing document from the majority of HOSC meetings, and this will hopefully add value to your questioning, etc. But the idea is to share that amongst everybody and share the information, because I think, you know, we should act as a collective body. So in the discussion around the forward programme specifically, I would like to hand over just briefly to Madeline so that Madeline can talk about one or two things.
Sorry. So you'll see under currently unscheduled topics, we were hoping this meeting to have a broader update on mental health, but it wasn't possible for various reasons. So, excuse me, the suggestion is that maybe we have an update at November if members would still like to. In the past, members have expressed an interest in getting more information about the primary care networks, and particularly, obviously, as the health system changes structure. I thought it might be useful if members had a briefing again at November, just to see what's the structure and anything coming out that going forwards. Another suggestion, again, possibly for November, is NHS continuing healthcare. And then other items on there, we had the autism strategy, and been advised that the most appropriate time for that is actually next municipal year in June. So my suggestion is that you keep it on your to be scheduled, with just bearing in mind it's probably not likely to be anytime soon. And another topic that members had wanted to look at previously, which we weren't able to schedule, was the continence service. Because the previous Health Watch had raised it as a concern. I had checked with the current Health Watch to see whether people were still raising it as an issue. I'm told that they weren't, but did members still, did members still want to obviously get an update, because they have indicated they'd be willing to come back, because it was showing as an issue to some residents a few months ago, in which case I would suggest perhaps January.
I would say yes, have the continents back in, because it may be that the current Health Watch has lost the connections with the people who were concerned under the previous Health Watch. So I would say yes, go ahead with it.
Continuing healthcare there, and I'm just trying to figure out NHS continuing healthcare. Are they not planning on continuing healthcare?
Perhaps Matt or Ingrid would be able to explain a bit better than I could as to what that actually means.
I think it's me, actually. I think Ingrid's gone. Continuing healthcare is a particular bit of NHS funding that pays for health needs in the community. So it's got a particular definition. I know it sort of sounds a bit funny, but it'd be worth getting an update on that and how well it's going in Woking, I think.
Thanks, Matt. Phil?
Sorry, yeah, mine was more to do with topics. You said that you've been looking at some areas that you can bring forward. How can we put forward things, or do you want us to put forward things that we want to be included on the list? Because at the previous meeting, I particularly asked for SCAS and I particularly asked for West Call, which are both areas which I think I'm concerned. Well, I am concerned about at the moment, and I'd like to know updates on those. But I guess that there may well be people that have got other things that are of interest. So, are you looking for us to put in our ideas and then you'll do a priority list? Or?
I think perhaps Madeline can talk about the administration and the engagement and all the hoops they have to go through, which I don't think is the purpose of this meeting. I think the purpose of this meeting is to get the requests out there. So I think West Call and those, the other topic you mentioned, sorry, I didn't hear it. Yeah. I think those topics are absolutely clear, and Madeline will put them on the list, and we will invite those people to come and talk to us. Absolutely. Sorry, Andy Croy.
To support what Phil says, to add to that list, I would like us to invite the people who run the Burma Hill surgery, the managers of Woking Medical Centre and if we can just write to them and ask them to come in and then explain what they're doing, what they've done and what they intend to do. That would be great.
Well, as a resident of Burma Hill surgery, I'm right with you there. So I completely agree with that as well.
It's an issue of great concern to many people, as you know.
So in terms of the forward programme, it's not to take away from this item at all in terms of getting ideas beforehand. It's just to obviously don't want to put members on the spot necessarily saying to fill up the forward programme. It's to help just to highlight some priorities or areas which have come up members may want to look at. If members don't want to look at or they'd like to prioritise something else, then obviously that's for the committee to decide. But obviously if you do have a burning topic that you're getting a lot of feedback from residents, then obviously do send it through and we can put it on the list and what have you, and also discuss it in this item. So it's not closing off anything. In terms of the SCAS and the West Call, West Berkshire Health Overview and Scrutiny were at their last meeting, I think in the next week or so, having exactly that item. So I think it would be helpful to see kind of what they got out of it. That because obviously they're right next door to us. That might yes, SCAS and West Call. That's certainly on their agenda. That might help structure anything that we would like to ask them as well.
I mean, one of the things I hope you see that we're trying to do, and Madeline and the team behind who are doing all the activities are trying to coordinate improved information and better alignment. And I think this is a really good thing to be doing, because if we have a briefing of what they've said to other people, then we can not only crib from that, but also potentially ask further searching questions. Rochelle.
One thing might be interesting to listen to is the update from some of the surgeries. We don't have to have the doctors come in or anything like this. Short, maybe three lines of what their challenges are, what their problem, any kind of problems they're having, what the council can do to help. make sure the services are developed better, delivered better to our residents.
That might be something that we could ask under the PCN update potentially.
Any comments about Burma Hills, things like this, and other places? We just want.
When we had our discussions, I think the majority of residents' questions are around the surgeries, are around access to GPs, are around problems. I mean, and I think one of the key points that was raised during our preparation meeting was that the ownership of the PCNs has changed. So we're going to start off at the head of the snake, if I can say it that way. You know, we're going to start off at the head and ask the ICB, you know, what they're doing with PCNs and what funding's in place and all those kind of things. And I think that's the right place to start, actually. But I absolutely agree with Andy Croy's point around Burma Hills specifically. David Hare.
I just make a point, please. I agree with Burma Hills, certainly. That's something which is something which is important, I think. But I think it would be good to, as a committee, to have what a GP's practice now is about, because certainly it isn't about just seeing your GP. It's about seeing the appropriate person at the appropriate time. And if you have to escalate, it can be escalated probably straight away. But you might see someone, you know, a healthcare assistant, and they might say, well, no, you will see the nurse, and the nurse might say, no, you will see a medical practitioner, and the medical practitioner might say, you need to see a GP, but you might not go to the GP first of all, because the thing is, and then this is something that certainly, okay, I declare an interest, as you know, but certainly that's something which GPs want us to know, that, you know, if you make an appointment with the surgery, it might not be to see the GP, but it might be to see the pharmacist because it's about your medication or whatever.
Thank you, Councillor Hare, for that description. If we could note that, that would be great. I think hopefully most of the people here understand that you may see a different person depending on the situation. But thank you for that. Anybody else for anything else? Andy?
Sorry. I would just like to say how much I welcome the effort to get lots of items on the agenda, because I think historically the health HOSC has been very, very light compared to the other committees. So thank you.
Well, I can only talk from a personal perspective, and I'm not light.
Well, what I would
You're not HOSC either.
Well, what I would say is we actually had several things that we didn't get through, and we often have a problem on HOSC that we have people from outside coming in and then they, you know, say they can't get in. So, which brings me to the point about the autism strategy, which is something that, you know, in May 21, whatever members said, we want to look at this. It's very important to our residents. Yeah, you know, we've got it down for possibly June 23. Is the autism strategy, I understand it, you know, it is, I'm sure it's a dynamic working document, David, but could we look at it sooner than June 23? I mean, June 23 is not even within the life of this committee, so it feels like it's being pushed out. So could we bring it forward?
The reason why it was suggested as June 23 was because a new officer had been brought in to drive it a new officer had been brought in to drive it forward. So that was the time that the service was suggesting would be the most appropriate time for you to get an update. But I can certainly ask if it would be possible to have it earlier, which is why I was suggesting that it stays on your forward programme.
Yeah, I'd like to know what the council is doing right now for our adults with autism, and, you know, let's get this committee's input in developing it. But please don't push it out until the next committee. Yeah.
Matt, do you want to comment?
Yeah, I think we can bring that forward. Yeah, definitely.
Thank you, Councillor.
The strategy has been written, so it's there. It just needs to be worked on. There's a new officer coming in, that's all. But, you know, if we do it earlier, then we do it earlier.
I mean, I would like to corroborate Alison's comments as well. For ages and ages and ages, we were trying to get the dentist to turn up, and it was like pulling teeth. Sorry, apologies for that one. I had to include that. I think we're at. If you could, please.
Sorry,
Madeline.
everyone. If I could just summarise and just check that you're happy with what I said in terms of November, then we have a general update on mental health services, primary care networks, and the NHS continuing healthcare, and in addition to our usual updates of the KPIs if available and the Health Watch update. And then I would suggest potentially the continent survey for January, because I think any more in November would be too much. And then obviously I can discuss with officers, Alison, about when we can get the autism strategy back earlier. Matt, is the autism strategy in January a reasonable request?
It is, yeah. Let's do it in January. Yeah.
Okay.
Sorry, Rochelle.
We also make sure that monitor.gov is actually updated completely, because when this doesn't agree with that, it means I have to start reading this and getting that. I'd rather use my electronic things than creating more paper waste for recycling.
And Andy,
I just wanted to hear when the letter to the Burnley Hills people is going to go. Are we going to invite them to come in as soon as they can, or are we going to say January? Because I think we should be, one of the roles of this committee is to perhaps put them under a little bit of pressure and say we'd like you to come in at your earliest convenience and leave it there.
I will look into whether that could be something as part of the PCN update, or before, but we will look at it straight away and come back and try and get them as soon as possible.
I think I would personally prefer to see it as a standalone thing. I don't know what I think.
Alison.
I presume we're looking at Q2 KPIs in the November meeting, but is there one meeting when we won't have the KPIs because it doesn't align, or have we got those at every meeting? In which case, the KPIs perhaps should be on the forward programme.
I think we can close, unless there's anything else. Matt and the team, Ingrid, etc. Thank you very, very much for your participation, and look forward to seeing you next time. And thank you to all the councillors. Thank you very much. Good evening. Good night.